My name is Tamara Issacs Ciocci, and I have type 1 Gaucher disease. I was diagnosed at age 21, and it took 21 years to diagnose. My journey began with a simple hip break that was when I was 18 months old. It was as simple as falling off of a bed. And from that hip break, my childhood was riddled with a number of illnesses that were hard to diagnose, and they were hard to let's just put it this way, they were hard to diagnose and they were quite frequent. I've been diagnosed 3 times with leukemia at ages 8, 12, and 21, and I've also been diagnosed with rheumatoid arthritis and lupus. By the time I was 8 years old, I had a low platelet count, a large spleen, and a large liver. My illnesses at the time would always start with the same series of events. It would start with a sore throat, a fever, and bone pain. I would cycle through bouts of health and then bouts of illness. At age 12, I missed most of my 6th grade year when I fell sick in the fall, and it started with the same symptoms: fever, sore throat, bone pain, and then it branched out into a multitude of other symptoms that pretty much resembled leukemia and other diseases. I missed most of a school year. My liver and spleen were quite large, and I was sent from specialist to specialist to diagnose, and lots of questions, no answers. At that time I was pretty sick, so my father, a doctor, his colleagues would stop by on their way to work and draw labs at my bedside. One of the things that happened between ages of 12 and 14 is I was introduced to a rheumatologist. He suggested that I had lupus disease. I never had a positive lupus test, but with the bone pain, large liver, and large spleen, lupus seemed like an appropriate diagnosis. My labs continued to be abnormal, and that was attributed to lupus as well. I was placed on steroids as well as an anti-malarial drug at the time, and it was from that form of treatment that I suffered significant bone loss that continues to haunt me to today. By the time I was 18, my liver and spleen had grown to about 20 times normal size. I had a 42-inch waist. My platelets were around 40,000, and I was unable to participate in many normal activities because there was a fear of rupturing my spleen as well as bleeding internally. When I went off to college, I had been riding my bicycle one day and I fell over the handlebars. And it was at that time when I landed in the emergency room, the rheumatologist met me and he told me that I did not have lupus disease and they thought I had leukemia. I was sent to USC Norris Cancer Hospital where I had a bone marrow biopsy and an endoscopy, and at age 21 I was diagnosed with Gaucher disease. My story is not unique for Gaucher disease. I think I represent a lot of patients who struggle to find diagnosis. I feel that one of the things that I identify with in other patients is the struggle to find a diagnosis. And now that once I had a diagnosis, there's a sense of relief in terms of knowing what I was dealing with and knowing that it was something that I would learn to manage over time.